Let's hear today's proverb, CT.
Good men must die, but death cannot kill their names.
Good men must die,
Yes,
but death
cannot.
cannot kill their names.
No.
This is a very, 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 very apt proverb for today. A good man died yesterday. His name was Dr. Stephen Mugusu, 28 years old, succumbed to COVID-19 complications. And according to the Kenya Medical Practitioners, Pharmacists and Dentists Union, at the time of his death, he had not received his salary for 5 months, had no insurance, and his young family has been left with no compensation. It's too steep a price for patriotism. Dr. Stephen Mugusu is the man that the Secretary General of KMPDU was talking to us about yesterday when he had a conversation with him on this show. And he told us, as we speak, as we're talking about the plight of healthcare workers, there's one of us who's in hospital. He's in ICU. He's fighting for his life. He has COVID-19. Dr. Mugusu had actually posted a message in a group of doctors, and this is what he had said. My dear colleagues, let me take this opportunity to admonish you today to get your pay or get out while you can with your health or life intact. I have had the COVID-19 for 5 days tonight, and I'll say not even a full pocket can replenish what has been lost on high oxygen flows, all manner of masks, and begging for one more gasp of fresh air. Usually I'd write and write, but today I just want to say, save your miserable selves from those institutions you live to earn again. I am not in any way inviting arguments or response to my post. I'm too weak to type anymore. Save yourselves. Dr. Mugusu passed away yesterday at the age of 28 in ICU. And you can imagine the kind of outcry because KMPDU circulated this information, announced this to the public and said, this doctor has died. And KMPDU said at the time of his death, he had not received a salary for five months. Doctors have been pushing to go on strike. They suspended their strike because they want to have this conversation. They've been invited by the health committees of the National Assembly and the Senate to have a conversation around this, around the issues that they've raised. Clinical officers and nurses went on strike yesterday. People who went to seek healthcare services in many public hospitals across the country yesterday were told, just rudi tu nyumbani. Clinical officer is the one in charge here. Nurse, the one who runs this facility, not available. Go back home. So people who are seeking health services today and yesterday are not getting those services. Doctors who were threatening to go on strike, they postponed their strike and said, let's just hear from these members of parliament and the Senate and hear what they have to tell us. But the issues that we're raising are the same issues. These are conversations that we've had many times. What would it take even for a government to see a statement like this from the Doctors Union and see, okay, let's not wait for Thursday to have that meeting. Let's meet tomorrow. What is it that is needed to happen for a government to even respond to something like this and say, it's okay, we have made a mistake, this should not have happened. Maybe Dr. Mugusu was not on the list that was supposed to have been on that particular list. This is where the mistake happened, and this is how come he was not. What would it take to get a response on this kind of thing?
Well, it seems that death doesn't matter. It would seem that something as morbid as death is not enough to say that let's do something about this. It would appear that even if people continue to die, if those who are on the front line, then who are charged with the responsibility of then providing healthcare to Kenya's people, are dying for lack of proper care, and even that have lived in a situation that would be akin to squalor for the last 5 months, nothing has been done about that. It seems that even that is not enough to elicit any kind of reaction. And I think if you get to that point, it's a terrible, terrible place to be in. And if you want to gauge the country by the way it treats its least vulnerable, its most vulnerable rather. Gauge the country that way. Gauge your leadership that way. Gauge the government that way. Because in this case, whether it is somebody with a degree in medicine, in that place, most vulnerable, sick, having not been paid for 5 months, and is still charged with the responsibility of providing healthcare. If you want to gauge and say, what is it going to take to elicit a response? That's how you gauge. Even death is not enough to elicit any kind of response. It doesn't matter. And I keep saying, The way your leadership tells you how they think about you is the way in which they react. Believe them. Believe them. They're not telling you anything apart from the truth.
This
Believe
is who
it.
they are.
This is it.
Let's have a conversation with two doctors this morning again. There's one doctor called Dr. Rain Mwendwa. Dr. Mwendwa is very, very active on social media. And a couple of days ago, when a number of doctors passed away, he recorded a video and shared it on his social media platforms. And he was talking about, this is it. I mean, we talk as if, it sounds as if we are just being selfish when we're talking about the plight of doctors. But this is what it means when you have one doctor not attending hospital, when you have two doctors who are hospitalized, when you have three doctors in ICU. This is the impact that it has, not just on the doctors who are in ICU, but in the entire population, in the people who need healthcare services. He's on the line. Also on the line is Dr. Elizabeth Gitau. She is the Chief Executive Officer of the Kenya Medical Association. Good morning, Dr. Aris.
Good morning.
It's good to have you on the show this morning, and I'm going to start with you, Dr. Gitau. The Kenya Medical Association, we have talked to the president, we have talked to other leadership of KMA and other doctors as well. Let's just first of all get a reaction from you. Dr. Mugusu, he passed away yesterday, and we know now from KMPDU and what KMPDU is saying, this is what he was going through all this time. What do you say to that?
It is very unfortunate that what have happened to Dr. Mugusu and his family. In fact, yesterday, at the time of his passing, I had just gone to donate convalescent plasma as a COVID survivor to him so that he can get help. It was devastating to get there and find the widow and being told that it's a little bit too late. What we have done to Dr. Mugusu and all the other young doctors who were either not employed or for those who were employed under the UHC program, and for 5 months on end, did not receive any pay. Dr. Mugusu, when he got sick, at that point in time, he sought help at the nearest facility where possibly he could afford. He did not have a medical cover. He did not have any direction from either the county or his employer, who is the Ministry of Health, as to where to seek help. By the time the situation was getting out of control, and he was very sick in HDU, having accumulated a very big bill, that is the time people are scattering all over because the union and the associations are asking what's happening to this doctor. That is the time now, you see now the county is coming in to ask for a bed at KU. At the time we got to KU, Dr. was very sick. It is such an emotive issue. I met the young doctors who are his colleagues there. And these young doctors are disenfranchised. We have mistreated them as a country. We have not allowed them to offer their skills. We have employed them under the most inhumane conditions that you can employ anybody. Can you imagine going for 5 months without any pay? And even the spouse, again, was one of the doctors who, again, did not get employed straight from internship, volunteered their services at Laikipia, and they were told volunteer so that you get a contract. After that, you get a contract which is honestly 3-month contract for a doctor, no medical cover, no compensation. We keep talking. I think from the beginning of the COVID-19 pandemic, KMA has met the government, KMA has met Senate, KMA has met National Assembly. We've even met CECs from the various counties, talking about issues, talking about compensation packages, talking about medical cover. And all these things, they'll be written from the office of the president on paper. But when it comes to the action, it doesn't happen. So I think from an association, I think we need to stop talking and make these things happen. I think at the bare minimum, what the association is calling for is that we must pay Dr. Mugusu's bill. Number 2, we must ensure that this does not happen to any other doctor. Number 3, his family must be compensated. Those are the bare minimums that we're talking about. And for the doctors who are unemployed, should be employed by the counties, and those who are employed under inhumane conditions, they must be placed under the correct contracts that are humane. Otherwise, I think we have lost it.
You know, Dr. Gitao, even as you say some of these things, yesterday we spoke with the CSC for CEC Health in Makwene County. And one of the things he told us that he said he's hard pressed to find that these are the conditions under which doctors are actually, or health workers are actually operating. So, I mean, let's leave the part of, you know, not being paid for 5 months, as difficult as that would be. Let's leave that aside. What are some of these conditions that we're actually seeing? What is the true situation on the ground? Because again, we'll be asked to prove and say, look, is it true that doctors and health workers are going and there's no provision of equipment, for example? There is no health insurance, even after top executives said, let's make sure that these provisions are made, that there are no allowances, there's no insurance. Is this truly how it is on ground? Doctors don't have access to this?
When this package, especially for NHIF, was brought, if you notice the small print, it said civil servants and for people under contract over 1 year. So what happened to Dr. Mugusu and his colleagues who are employed for 6-month contract? What happens to them? So for sure, some of the things that are declared, they're declared maybe so that you can say you're doing something. And even when it comes to PPEs, I think the biggest challenge has always been maybe the isolation facilities would have PPEs, and it's because they're getting support both from the county and from the Kenya COVID-19 fund. But there are those areas which are not isolation facilities, which do not get PPEs all the time. And maybe the challenge has always been when somebody comes and talks about where is the evidence, who are these doctors who don't have PPEs. I think unless you go to the ground and the day you find that doctors do not have these PPEs, or the PPE is provided, you're given a mask on Monday, then Tuesday, Wednesday you're not given, then you're given on Thursday. Does it mean you have adequate PPE? You know, the county will say, I have given PPE, but for Tuesday and Wednesday you didn't have PPE. That does not count as having access to PPE.
Sure.
Explain to us, Dr. Gitao, because you're saying that this young doctor, Dr. Mugusu, was employed under UHC and he was on contract. What's that and what's that all about?
So when the COVID-19 pandemic started, there was a call for increased human resource for health. And at that point in time, I think government at some point started said, okay, let's employ, I think, 2,000 healthcare workers. At the end of it, it ended up being about 200 doctors across the country, and these doctors were employed under the Ministry of Health, but sent to various counties.
Okay.
So each county was to get about 3 or 4 doctors. So this is an employee who's under the Ministry of Health, under a 6-month contract, but is working at a county facility.
Okay.
The same case as Dr. Mugusu. It's been 5 months down the line since they were employed, but these doctors have never been paid.
So the money that was set aside by the government, and this was coming from the UHC fund, 1 billion shillings, that's what the president announced, 1 billion shillings will be taken from the UHC budget to recruit healthcare workers to support in the fight against COVID-19. This falls in that category.
Yes, it does.
And you're saying that they have not been paid a single cent since they got employed?
Yes, they have not been paid. At least for Dr. Mugusu, we can confirm that Dr. Mugusu was never paid for 5 months. If government wants to pay right now, I'm sure they will go ahead and do a payment right now so that they can say they paid. But for 5 months, by the time Dr. Mugusu was dying, he had not received his pay for 5 months. And I think at this point in time, maybe is the point, I think we've become a very dishonest country. We make declarations, we've become dishonest, and also nobody takes responsibility. At this point in time, you'll see a lot of blame game. The government will say, look here, we've already paid. Or the county will say, this was not my worker, this was a worker belonging to the national government.
Yep.
Everybody will blame the other, and nobody takes responsibility. So I think until the day somebody takes responsibility and says, I am sorry, this was something wrong that happened to Dr. Mugusu, and it should not happen to any other health worker. That is the time maybe as a country we shall move forward and we shall believe that the government is actually taking responsibility.
If health workers who work in health facilities end up like the late Dr. Mugusu, then the picture you're painting, Dr. is an extremely dire and an extremely bleak one. What then is the hope for an ordinary Kenyan who doesn't have a medical training, doesn't have the ability to access medical care as easily as a doctor might? Are we saying, therefore, that the ordinary Kenyan should simply focus on having faith in staying alive, because there is no chance in hell that they will be taken care of should they unfortunately fall ill.
This, for sure, this is a situation. If you cannot take care of the healer, so what happens? What happens to the patient? If the doctor on the front line is unable to access the best level of care that they should be able to access, what happens to the ordinary Kenyan? I think it's a very sad situation. Maybe these stories are not told every day, but it is their situation that in this country, it is either illegal to be poor or it is illegal to depend on your government, such that you either have to be rich or be a politician for you to get help in this country.
Dr. Mwendwa, even as we have these conversations and we're talking about what has happened yesterday, it could be that everybody is very emotional about this unfortunate case that happened with Dr. Mugusu yesterday. But it just a brushstroke of the bigger picture of what is really, really going on. Is paying insurance, is paying allowances, is paying salaries enough to get this whole mess worked out? Is that the antidote to all of this?
First of all, thank you for having me this morning. I think I'll answer that with a question: is what is your life worth? You know, that's the best way I can answer that question, because there isn't any amount of money that can ever compensate for your life, no matter what. So I don't think the solution is just better pay, better insurance or health cover, but it will help. That will go a long way. But the solution of the problem at the end of the day is restructuring the entire system and not having content or adequate leadership in place, because we can keep blaming this person and that person, national, county. We need to understand that this system is not working, even when it was just national. And this is so sad, because I went through the same thing. When you start your internship and you're a national, you're literally told that you will not receive a salary for at least 3 months. Like, how is that normal?
Can I stop you there? Can I stop you there before you go on? I want to understand this conversation that takes place when you're told, first of all, as you start off as an intern, you are under the understanding that you will be earning something on a monthly basis, right? It's an agreement.
Yes.
Okay.
Because
so how does this conversation evolve to understand that you will not earn anything for 3 months? How does that happen?
So that happens at the Ministry of Health offices. When you go there, you are posted to a particular area to go and do your internship in a referral and training hospital. And basically in the office, you'll be told, like, okay, you have been posted, let's say, for example, Garissa, or for example, Lamu, where I was working. And here you are, you're living in Nairobi, and you're told, go. There will be some delays in salaries. Usually, they don't tell you how long, but you get this from the doctor who is now finished internship tells you, hey, boss, forget it. 3 months, you're not getting paid. I waited 3 months borrowing money. It took 5 months to get to get paid. When in my first month of internship, my mother died. Now, you can imagine, I have the title doctor, funeral arrangements, expenses, hospital bills, and here is the doctor, fresh into internship, and I have nothing to show for it. I have no salary to go and start looking or chipping in to prepare for my mother's funeral. So this is a reality, people. Like, it's something that we don't speak about as doctors, because, you know, as a doctor, you're seen as this prestigious person. And I've been listening in and you know, having this conversation that even if a doctor, a person like a doctor, so you need to understand that doctors are very much Kenyans. We're not balling out of control. Our bank accounts are not that good, especially the young doctor.
But doctor, I have to ask this. going back, because like I said, even when we heard this answer from Dr. Gitao, we're very emotional about this. Everybody, on this side is very emotional about all of this that's going on. But going to the nitty gritty is probably the way to solve to look at how this problem can be solved. When you're told that you're not going to receive your salary for 3 months, and the person who was there preceding you also went through that same, what is the reason why? Is there a delay from money coming from? What is the reason why you're given?
This is a deliberate thing from the state. This is a deliberate thing from the state. And I'll give you an example. Right now we have 2,000 unemployed doctors. 2,000 doctors who have qualified, but they have no salary. So what you do is you create unemployment, put people in the most desperate situation. The doctor knows his worth. There was a CBA that was signed in 2017 that structures the salary of a doctor. But they will not give you that salary because you have been sitting at home for 2 years. 2 years. I didn't get paid for 5 months. These are people who are sitting at home for 2 years. If you offer this person even 30,000,
they'll take it.
Are they not going to take it?
They'll take it.
Exactly. So this is the situation. When you create a situation where people are desperate, people will go for crumbs. They will not wait for the whole cake. They will literally eat the crumbs. And this is a deliberate situation that they've created. Because once that CBA was signed and sealed, that is still not delivered to date, they understand. There's this thing of, the doctor always having, and I saw Alfred Mutua saying we are very entitled, or we think ABC. We know our rights and we know what we're doing there. We're in the middle of a war. We're on the front line. Yesterday, a 28-year-old man died. Our whole father died yesterday. And you went there knowingly, and he hasn't received any pay. And he says that in his message, even if I was paid $1 million, what will that $1 million do to help the oxygen enter my lungs?
Yeah.
And it's not going in.
Yeah.
You know what I'm saying?
Yeah. We are speaking with two doctors. Dr. Rain Wenda is a pediatrician, and Dr. Elizabeth Gitao is the CEO of the Kenya Medical Association. A doctor died yesterday, and nurses and clinicians are on strike. The issue of doctors being the frontline workers, the healthcare workers being the frontline workers in the fight against COVID-19, and how then they are being treated by the government is a conversation we had yesterday, is a conversation we're having today, and this morning we want to seek answers. What will it take for the government to act? The Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, announced to the public that Dr. Stephen Mugusu, a 28-year-old doctor, married, has a family, passed away in the ICU of a hospital in the country, where he succumbed to complications from COVID-19. The KMPDU went ahead also to announce that this doctor has been working for the people of Kenya, and he has not received a single shilling in payment for 5 months. This is where now the rubber meets the road. So, Dr. Mugusu was employed by the government, by the health ministry, after that announcement that was made by the president that, to fight COVID-19, this is what we are doing. We are reorganizing our budgets. So we've gone to Parliament and we've asked them, because you had approved X amount of shillings as budget for universal health coverage for this financial year, let's reorganize that, take a bit of that money and hire healthcare workers across the country to support those that are already employed in the fight against COVID-19. Dr. Mugusu is one of the about 200 doctors who are employed, deployed to a county, supposed to be paid by the Ministry of Health. Until his death yesterday, he had not received a single shilling in payment from the government. This is the government that has told us how it has spent so much money in the fight against COVID-19. That is one issue. Let's put it on ice for a bit, okay? Second issue. This is a doctor who, when he started feeling ill, he had to look for the nearest and cheapest health facility to go to. And until the issue then reached the other doctors and union officials and it became a big issue, that's when now he was being transferred, he was being taken to other hospitals, and he passed away in an ICU facility. He has left a bill that doctors are asking us to help contribute so that we can remove the body of Dr. Mugusu from mortuary. There's a bill. This is a doctor who does not have medical cover. employed to fight COVID-19 this time. Issue number 2, ICE. Move it on the side. Dr. Mugusu had actually written to a group of doctors about a couple of days before he passed away. And he told them, you know what, guys, what I have gone through, if you are here working and facing the same kind of plight that I'm facing, please just get out of this. Stop working for government. It's not worth your life. It's not worth whatever I have gone through. This is a doctor who's feeling there's no point in serving if this is what it takes. This is where we are as a country. These are the conversations that this one doctor has brought to the fore for us to face as a country. What will it take for those in leadership, for those in the Ministry of Health, for those in State House, for those in Upper Hill, the office in Upper Hill belonging to the opposition leader who has a big say in how the government is running? What will it take for anybody in positions of authority to realize that when doctors issued a 21-day strike notice, they were not Sumbua? When nurses issued a 14-day strike notice and they went on strike yesterday, it was not for Sumbua reasons. When clinical officers issued a 14-day strike notice and they went on strike, it was not for Sumbua reasons. That when you and I today fall sick and we are seeking healthcare in any facility, public facility across the country, and we don't get a doctor, we don't get a clinical officer because they're on strike, it is not for Sumbua. It is about life and death. When will it hit them? We are speaking this morning with Dr. Rain Mwendwa. He is a pediatrician. He is one of the doctors who's been very vocal about this issue. We are also speaking with Dr. Elizabeth Gitau. She is the CEO of the Kenya Medical Association.
I guess a question for both of you now, or just as we continue with these, as we've been looking at what exactly is going on here. And so there's a strike, and one thing that we spoke about this strike yesterday, and it's a direct question, because I don't see the strike now as turning up their noses to the situation. I see it as almost a willing of the government to do something. We don't want to go on strike, but here we are being forced to strike, begging you to do something about this situation. Is then this strike warranted by the clinical officers, by the nurses, by the doctors who are now in conversation with government, as it were? Is it absolutely necessary to have this now turn of action taken?
Start with you, Dr. Rain.
Okay, thank you for the question. I would say it is more than warranted because, unfortunately, we as the Kenyan people only respond when we are threatened. We don't respond when we're asked nicely. When you're told pay your taxes by this month, please kindly, you don't. But when you're told if you don't pay tax by this time, you'll be fined X amount, then you take it seriously. So, and by the time you go on strike, let's get this straight. We don't like going on strike. When you say that there's no nurse, there's no clinical officer right now in any public facility, that means my family members cannot get attended to. That means my own family can lack healthcare services. But that is something that, my family is well aware of. They understand the situation. They know the plight of the healthcare worker. They understand that this is a life and death situation. Before COVID, we were not having this strike situation or this very tense situation, because that time it was still the back and forth in the offices, go to the national government, go to the county, the usual ping pong that, when you try to address issues. But when it gets to a point where your back is up against the wall, you are literally in a life and death situation. And I literally told doctors, it gets to a point where you just have to kubali, because that is how defeated we feel as healthcare workers, that we literally now have to just, it's a personal choice. I can go to work and get a salary, but at the same time, I can go there not fully protected and I can die. You have to come into terms with that. So this strike is warranted. I really hope that this time we don't get to the point where we actually have to go on strike. I really hope that this means that whatever the media has been talking about, whatever the situation that we have been very vocal about, is actually making these people think whether they want to actually sit down and meet. I don't like to call them demands, but to meet the rights we are asking for as healthcare workers, and as doctors. So definitely warranted. I mean, if Stephen's story is not a clear example, if Professor Were's death is not a clear example, if the 9 clinical officers who have died is not a clear example, we're talking life, then I don't know what else will warrant a strike like this. That's the reason.
There's something that has been doing the rounds in my mind. There's this call that the doctors have had for the longest time. It's a question for both you and Dr. Gitau regarding a commission. In the circumstances that we now find ourselves in, how would a commission have been useful?
Maybe I can answer that regarding the Health Service Commission.
Yes.
The reason the doctors call for a Health Service Commission is because with the Health Service Commission, you will set up a mechanism which allows for equal employment for healthcare workers across the country, will allow for rationalization of the provision of services across the country. Meaning, like, if one county has 20 OBGYN and another one has 1, you share them based on the needs of the Kenyans, not based on who trained that OBGYN or who had that doctor at that point or who hired. So the services will not be dependent on how much the county can pay, but will be dependent on rationalization of services across the country. In terms of payment, again, of these healthcare workers, in terms of the opportunities and the compensation for their services would be the same. Because clearly, right now, doctors are on different schemes of service. We have doctors who are employed previously, they're on permanent and pensionable, they have a scheme, they have an insurance scheme. Counties decide which medical scheme they will pay or will not pay. Some counties will pay comprehensive NHIF, some counties will not pay. So that unequal treatment of healthcare workers makes service provision across the country not be standardized. Were we to treat our healthcare workers in a standard way in terms of training opportunities, in terms of compensation, and in terms of ensuring that they are there to the procedures and protocols, I think we would actually have better quality of care across the country and a better satisfied healthcare worker.
But how would this work if you had a commission? I mean, we have a ministry, but health is a devolved function. So are you saying that is it something that you will automatically belong to, or is it something that you must join like a union?
So ideally, it is a government function. So the same way you'd have a teacher service commission, which is the employer of teachers. And I think it is possible, and I think the ministry has shown us it is possible, that you can actually hire a doctor on the UHC program and send them to a county. So this is not something that is not doable. It is something that you can second employees to other counties, and you can always find financial ways within the 2 levels of government to ensure this person is actually paid, so that we can standardize. We live in one country, so it is honestly not fair to have patients who are treated in different ways across the country, depending on what these counties are either able to afford or what they care to afford.
In your opinion, what would require doing for this to be effective? Because you've talked the management of the union that the doctors belong to has been at this for quite some time. And are you making any progress? Is there light at the end of this particular tunnel? Is it likely that you may have a commission? And if not, what do you need to do beyond the strike, of course? What do you need to do in order to ensure that you actually get this commission?
For me, I think we need goodwill. We need goodwill. We need goodwill straight from the president's office. We need goodwill from parliament. We need goodwill from the governors. I think we've had this conversation on and off with various levels of government, including even the COG. Nobody is taking away their power on their workers. Nobody is taking away their payroll. But at the end of the day, we all need to agree that a health service commission is important for us to be able to move forward and to be able to manage health in a better way. So I think the biggest stumbling block, of course, has always been the balance between now the governors and the central government and levels of control. So I think it is a conversation which is beyond the doctors, but the doctors are sort of held at ransom by 2 levels of government who refuse to agree. But I think it is possible to find a way forward if both levels of government had goodwill of the public, because at the end of the day, if you are to scrutinize the proposals that are made for us to have a health service commission, it is in the interest of everybody, including counties, who will actually benefit from better HR and less cost in terms of hiring.
Okay, so I mean, like we're talking about now, I think what we've often seen, and for both of you as well, what we've often seen is that if we look at the numbers over the last 3-4 years, 3 years to 2 actually, there have been 100 notices of strike from this sector alone. Right? And every time there's been some kind of piecemeal offering that has then been dangled or given in terms of crumbs, and everybody has gone back to work, and the issue has been swept under the carpet until now I think the carpet is reaching the ceiling. Right? Now, we are in that situation again where talks are being had at the very last moment, for the doctors at least. There was the call from both Senate and the National Assembly to come and let us reason together. Right? I see this as a potential danger of going back into the same thing that has been the case for the last, at least for the CBA that we're talking about, 2017 to 2020. I see a danger that lies here. We could all be very emotional. And some of the things that you said, Dr. Gitao, they could pay the bill for Dr. Mugusu. They could pay this bill. They could compensate his family. His family could be compensated. Everything could be sorted and done, but that doesn't solve the problem. We take care of the symptoms. I mean, you're doctor, so you understand, but we're not dealing with the root cause of the problem. I see a potential danger here, that talks could be had and top layer action could be taken, but the root of the problem will not be solved. And unfortunately, as doctors, you're lying in the position whereby an action could be taken, or again, the issue is swept under the carpet. And I've got to ask the very difficult question of, what are you really ready to do to make sure that this issue, again, is not swept under the carpet once the tears have dried and once a compensation, for example, is done?
I think we need to just stick to our ground. If I can just take that shortly. It's basically, for this thing to work, all those demands or rights that I like to call them must be put in place. And one of them is the Health Service Commission. And we've made it clear. This time around, it's all or nothing. I hope that the union also, adheres to sticking to those. And from the conversations that I've been having with them is that it's all or nothing. It's either you make sure that doctors are employed permanent and pensionable, you make sure that there's a Health Service Commission, you make sure that the 2,000 unemployed doctors are given permanent and pensionable contracts. You make sure we have comprehensive medical cover. You make sure that we have a life insurance cover. I mean, those are not demands. Those are rights, given that we are basically in the front line. And yes, the root problem is, this is bigger than health. This is, yes, we have a Teacher Service Commission, we have a JSC, and the question, and we've had a CBA. We have so many good things in this blueprint of a system that we call the Constitution, but we are not even implementing all those good things we have. So there is no goodwill from the current leadership. There is, everybody decides to do what they feel like doing or what is good for them. They don't put the people and the Kenyans and the system. Kenya would be very far if we followed the Constitution. So it's bigger than health. It's really about us Kenyans sitting down and asking ourselves, because we can't just put this on. You can't throw this and say, so you doctors, now that you've communicated with the government, do you see the problem is the root cause, the cancer. The cancer is the current leadership and the current government. And once we uproot it and rebuild it and follow the Constitution, and I'm not talking about referendum.
You're getting political here.
No, you asked me a question.
Nothing wrong with being political. I'm merely stating the obvious, but nothing wrong with being political. This situation sometimes requires a little political injection, so it's fine.
It is the political problem.
Yes, it is a political problem, really.
It is very political. And when you start involving health and politics, then we have a problem, because health, number one, does not know politics. The COVID-19 virus does not know politics. The COVID-19 virus does not know your financial situation. It knows survival. It is a virus. It will mutate. It will get into its host and it will thrive.
So,
And
Dr.
in fact, it will kill somebody.
Dr. Mondo, you're saying for you where you sit and when you look at this issue, you're saying the problem here is lack of will, goodwill from the government, and not just government but the current administration.
Yes, the current government, the current administration, the current Ministry of Health, because if you cannot sit down with the doctors or any healthcare workers and understand the situation, and the last time I had a conversation with young doctors, what young doctors want, we would hate to believe that these are situations or information that is given to the CS of health or given to the president and he ignores, or given to the governors. There is a way that this information that is being relayed to them is not reaching to them, and the priorities and the people advising them are not advising accordingly. So that's where the problem is. Give us a platform, speak to the people on the ground, as government. Yes, you can talk to your unions, you can talk to your associations and whatever, which is good, because they're also fighting for the same thing. But for yourselves,
Dr. Wanda, there's something you said here. You mentioned that it's all or nothing. I want to understand this. What do you mean when you say it's all or nothing?
So all those things I stated,
Yes.
Health Service Commission, employment of 2,000 doctors, permanent and pensionable contracts for doctors, comprehensive, basically those rights. It's either you deliver them all, because the reason why there is more time is because it's those ones of, we can give you two things, but you people need to be reasonable. You can't get everything you want.
Yeah.
Because that is the narrative that is always, once you sit down on the table, you're told, you have demands, but we can't give you everything. And you should be happy with that. But if everything is my constitutional right, is the Kenyans' basic human right, and it's in the Constitution, then I demand it, and you must implement it.
But what if they're not able to implement it? That's what I'm actually asking. What if they're not able to? They may want to, but they're not. What then do you do?
Hey. Okay, according to the strike notice, and as you can see, there's no clinical officer in nursing in hospital right now. And the unfortunate thing is that the last time there was a strike, it took 100 days. You know why? This time it's going to be different because of the COVID-19. It took over 100 days because when the public sector was ailing, when Wanjiku could not get health care, us comfortable people in our middle class with health insurance were going to seek healthcare in private sector. So we didn't feel the effect. You didn't hear Wanjiku's cry when she's not getting a gynae, when she's not getting a surgeon, But when the private sector joined, when KMA came out, the Private Hospital Association came out and said, doctors have been jailed. This is unacceptable.
Yeah.
Within 24 hours, the strike came to an end. So once Kenyans realize that you can't get health care, and I'm talking about all the Kenyans, including the ministers and the VIPs and whoever who seek health care in private sector, once people realize this is serious, your doctors are dying, there won't be people left. Because if you keep going on, even Mugusu today, how many have we lost? By the time it's 2022, how many doctors are you going to have left if things keep going the way they're going?
Dr. Gitao.
So who's going to treat you?
Yeah.
Okay, so now we've heard some of the things which are unverified, but some of the things that we do know and that we've heard over the last 24 hours, that there are some who've called out and said, Vumilia until COVID ends. Everybody is going through a difficult situation at this point, right? People's salaries have been slashed in half. The economy is, in a mess. And then the calls have been towards doctors that, guys, please understand, we're going through a tough time. Just hang on, hold on a little bit more, and once COVID is over, we'll be able to address these needs.
Essentially, you're being told just continue suffering for a little while longer.
Yeah, it leaves a very bad taste in my mouth. But let me know, how does it feel when you hear this, and can you Vumilia?
It is so infuriating when we hear such statements, especially when you're being told to Vumilia. You as a doctor are being told to suffer, yet you're the one who's supposed to take care of the Kenyans who is suffering. So who is helping the other at the end of the day? And we are not asking for big things. It is a matter of life and death. We are asking for PPEs that to be readily available at all health facilities. That is not something you tell someone Vumilia. If I die tomorrow, will I Vumilia in the grave? So I think those statements are made in bad taste. Maybe whatever the leaders were thinking at that point, I don't know. But those statements, I think, to the doctors, they are very infuriating. They make it means that, one, you do not understand the situation on the ground. You do not understand that there are people on the front line who they are putting their lives at risk to take care of your constituents, to take care of the people who've elected you. And I think the biggest challenge in this country, I think, is goodwill and accountability. We have zero goodwill. We just say things. Like literally somebody will come and say we'll give comprehensive, in terms of the compensation package and in terms of the group cover. These things were said, letters were done. But in terms of it being somebody being made accountable to ensure that it happens, nobody is accountable. We had a KEMSA issue. Nobody has ever been placed accountable. This how many months down in the pandemic, we still don't know who took responsibility for that issue. And all we are asking is that somebody to take responsibility for the things that are happening in this country and for us to have goodwill. Currently, we have moved on to, I think, another agenda. Yet Kenyans have COVID-19. We have money to actually push certain agendas, certain political agendas, but you don't have money for a country. I think in this country, we have no servants. I think leaders are expected to be servants. Our politicians are expected to serve the people. But I think we developed an aristocratic system where we have kings and queens who we actually serve. At the end of the day, I think they only collect a salary and make things better for themselves at that political place of leadership. But in terms of serving the Kenyans, we lost it.
When you say that, and this is the final question to you, Dr. Gitau, when you say that somebody should take responsibility, who, in your opinion, should take responsibility over what's happening now?
I would say at the very least, the CS of the Ministry of Health should have taken responsibility for all the failings that have happened in the system, and failure to which his appointing authority should take responsibility, and that is the president should take responsibility, and for the work that has been done, and for the work that has not been done, for the doctors that have not been employed, for the doctors that have not been paid, for the doctors who don't have medical insurance, for that Kenyan who died because there was no clinical officer or nurse or doctor in the facility. I think at the very least, the top authority should take responsibility.
Thank you very much. We want to thank you very much, Dr. Elizabeth Gitau, the Chief Executive Officer of the Kenya Medical Association, as well as pediatrician Dr. Rain Mwendwa, for speaking to us this morning. Asanteni sana, and we want to thank you for continued service. We wish you all the best, and we join you in this push for better service delivery.
Thank you.
Thank you.
Vice FM, Malindi.